Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello and welcome to Podcast. And with me today is someone who is so well known in the field of dentistry that he probably doesn't need an introduction, but I am contractually obliged to introduce you. So it's Michael Bentley. Thank you very much for joining us, Michael.
Oh, it's my absolute pleasure.
Now, as people probably know, you've been involved in dentistry for a couple of years now, and you actually started out as a dental nurse. Yes? No?
No. I started as a practice manager.
Right.
I worked for Boots Dental Care to start with. I was a practice manager for Donovan H Opticians first.
Yes.
Then saw the advert for Boots and thought, opening a new practice, that's a nice challenge. So I got the job and that was my foray into dentistry. I did start to do some nursing at Boots, but didn't go on a recognised qualification, anything like that. The nurses didn't need to be on the GDC register in those days either, so it wasn't a mandatory requirement, if that makes sense as well. But then Boots exited dentistry and moved to a fantastic practice in the Midlands called JM Dental Care as their business manager. And as part of the initial part of me being a business manager, we extended the practice and put in a treatment coordination route. So I started my journey into treatment coordination and working with patients. And when I'd done that for about 2 to 3 years, then the GDC said the nurses needed to be on the register. Right. And at that time, because I was doing a lot of clinical conversations, I thought it's time to put the money and the training into being a qualified dental nurse. So I did that in 2009 and I've been on the register ever since.
Right, but you've been a practice manager.
Yeah.
You've been a dental nurse and you've been a TCO. So
yeah.
You know everything backwards.
Yeah, and receptionist.
And full.
So yes,
as well.
So I've done the 4 squares apart from actually doing the actual, if you like, the dentistry. Yeah. Actually treating the teeth.
So thinking about your treatment coordination, what is it that you think that a treatment coordinator brings to a practice?
So first and foremost, I want to stop a myth straight away. Treatment coordinators are not salespeople. And I think there's a distinction that the TCOs are there to wrap up a sale. And that's just not the case. For me, TCOs are all about implementing the GDC standards. And what I mean by that is principles 1 to 9. And the first 4 principles are all around communication, putting the patient's interests first, and making sure we obtain valid consent in an area where we're not discussing treatment in front of other people that can hear it. So if you like, in the right GDPR space. Yeah. And another word that I love around treatment coordination is the translator for the patient.
Right.
And patients take on information differently depending on who they are, what research they've already done, what their primary wants are from your practice, whether that is I'm in pain, I've got teeth that are broken and worn down and I want help with those. Yeah. I want some aesthetic dentistry. I want a mixture of all 3. And then you've got to look at how does the patient interact and take on information. And that can be visually, it can be through different styles of communication. But ultimately, the TCOs have time to spend with patients on a one-to-one basis where they build a fantastic relationship and they can then be there to translate and make sure that the information that they're being given clinically is understood by the patient. And by understanding that information, the patient can then feel really confident about deciding what treatment pathway is right for them.
Yeah, so you're sort of the go-between between the actual clinical bit with the dentist and then actually sorting everything out. From what you said there, it's very sort of patient-centered. I've heard them called patient coordinators recently. Is that?
Yeah, I think like anything in dentistry, I think treatment coordination has advanced quite a lot over the years. I mean, when I first did treatment coordination, it was back in 2005. So that is a long time ago. You know, in our early days, we were trained by the American consultants, people like Kathy Jameson, who was a very brash American. I adored her. And, you know, there wasn't very many of us in the country. But as, you know, now we're heading, you know, into 2026, that, you know, people are going, what's the right title for our patients to understand? And if you like, you know, treatment coordinator is understood by people that work in dentistry now, but is that word understood by a patient? So the only way of patients understanding it is either you introduce what a treatment coordinator actually is and you explain to somebody what the role of a treatment coordinator is, and people retain TCO as their title, which some practices do, or some practices have looked at, you know, patient experience manager, patient relationship coordinator, things like that, where, you know, you're, if you like, you're putting that patient word in, if that makes sense.
Yes.
I still like treatment coordinator. For me, it gives that air of professionalism, you know, around the role. And I don't want, maybe that's because I did come from optics and we used to be called patient smile advisors, you know. And that's where, you know, you'd look at somebody's face and we used to have like a silver and gold placard that we used to turn and go, oh, yeah, you look like a warmer colour for glasses or a cooler colour for glasses and things like that. So you were known as an advisor. And for me, treatment coordinators have a professional responsibility to maintain the GDC standards and also to confirm information from the clinicians that the patients are hearing that information from. So not only has a treatment coordinator got to form a fantastic relationship with the patient, they've also got to form a fantastic relationship with every single clinician that works in the business as well. And, you know, as you say, they become the middle, you know, a really effective middle marker, you know, between the clinicians and what they're trying to say to a patient and also the patient understanding that information as well. So I feel the treatment coordinator, you know, title works very, very well indeed still. And that would be my go-to name for it.
Okay, so you're team treatment coordinator all the way.
Yeah, I am.
Definitely. So what sort of person suits being a treatment coordinator?
That's a really good question. And for me, first and foremost, it has to be somebody that is a brilliant communicator. And what I mean by a brilliant communicator is that they're able to communicate to anybody with an ease. And it doesn't matter if they're older, younger, middle-aged, that they are what you would say maybe a very difficult personality in terms of they like a lot of detailed information. So somebody that wants a really fast experience and in between an emotion experience. You've got to remember that patients are emotional about dentistry and there's a lot of emotions. Fear is one of those emotions. And other emotions are that, you know, worry about treatment, overwhelm, embarrassment. You know, a lot of patients come in and go, you know, don't even look at my mouth. I'm so ashamed of it. Do you know what I mean? Yeah. There's also, you know, emotions around the expense of dentistry and being able to afford it. Yeah. The, you know, the health emotion that's around it as well. And, you know, that I don't really know what I'm doing. Do you know what I mean? And then patients are, you know, very assured of what it is that they want and you will give it to me as well. Yeah. And you've got to, as a treatment coordinator, be able to balance your own emotion with the person's emotion that you're talking to. And that's where the real skill is. The dentistry can be learnt. There are a lot of nurses that have become treatment coordinators, and treatment coordinators started to have a bit of a blurred line because we're adding that within treatment coordination, dental nurses will take a digital scan. They will take a full set of photographs. Some nurses are even radiographers, so they'll maybe take an X-ray, you know, as part of the lead-in, you know, to the clinical setting. And for me, we've got to be mindful about that. That is bordering clinical treatment coordination, where you've got to be on the GDC register to deliver that. Yeah. Treatment coordination is not a GDC registered role. So we've got to remember that the pure essence of TCO is communication with the patient. And that is that should run through the very heart of the TCO, to be able to communicate with the patients and be able to communicate with the clinical team. And if you can do that, you'll be an excellent treatment coordinator.
Yeah, I mean, something that that often comes up in when you're talking about the dental practice is progression.
Yeah.
I mean, would you say that being a TCO sets you up well to be something like a practice manager?
Well, that's a very interesting question as well. And my answer to that is a yes and no answer. Not trying to stay on the fence, but I feel that some treatment coordinators, that is their lane. That is what they're good at. And they're good at speaking to patients. And when you take them away to running a business and having to be all over leadership, you're changing the set of skills that is needed from being a TCO to being an actual practice manager, which is a different set. Yes, that makes sense.
No, that makes perfect.
However, practice managers are often brand leaders in the business.
Yeah.
They understand what the owners want to deliver. And often practice managers are a blueprint to putting treatment coordination into practices and therefore become one of the treatment coordinators in practice. That's my journey. Yeah, I was the blueprint person. And if you took treatment coordination off me completely, I wasn't happy. I like to do 2 days a week of treatment coordination within my role of practice management. So I learned that I needed other leaders to delegate things to that allowed me to continue being a treatment coordinator in the practice. So that's why my answer is yes or no, because there are some practice managers in the UK that are really, really fabulous at treatment coordination as well. But I think if you're a TCO and then moving to practice management, you need a different armory to go to practice management. You know, you need a lot of other skills, you know, HR being one of the leading skills that you need, you know, to be an effective practice manager. And you might have some really great communication skills that would lend themselves very well to going into practice management, but it's a bigger job than that. It's a real step up, I think, from going to practice management.
It was the communication aspect of it that was just sort of like sending me towards the idea that it might be a good thing for setting someone up to move into practice management. So really, sort of final question is, what are people who don't have a treatment coordinator missing out?
That is a really great question as well. What they're missing out on is we talk about the patient experience a lot. And what we need to do in order to make sure that patients understand what is going on at all times, and how do we make sure as well that they really value the dentistry that you're doing. And for me, numbers speak for themselves as well. When you're looking at what dentists can actually convert on their own and what they convert working alongside a treatment coordinator, the figures generally indicate that working with a treatment coordinator will accelerate the conversion figures. And that is because the patients are able to take the time that they need to make an informed decision about their dentistry. A lot of patients are seen by incredible dentists where they have really good communication in a surgery setting. But as soon as they walk out of that door, that patient seems to delete information as they walk to the reception desk. And if you are a patient that absolutely knows your own mind, by the time you walk out that surgery, the reception desk, those are the treatment plans that will be booked straight away.
Yeah.
But there are a lot of treatment plans where they're left at the desk. The reception team, you know, go to what I call a default setting, which is have a think about what you want to do. And when you're ready, contact the practice and we'll book in the treatment. And it's never booked. And then it ends up being on a list. And then the practices go, well, you've seen however many patients it is today, whether it's new patients or existing patients, you plan treatment and they haven't had the treatment. Why not? And if you don't have a treatment coordinator, that's really difficult to then understand why the patient is objected to treatment. Is it time? Is it worry? Is it the financial planning of it? And I think there is a lot of skills that a treatment coordinator can bring just to go, look, we can do things in stages. You know, not everything has to be done at once.
Yeah.
And I think sometimes dentists are very quick to produce a treatment plan that is exhaustive, that has got all the different options on it. And then there's a big sub at the end of that treatment plan that doesn't necessarily correspond to the patient doesn't have to have everything that's been outlined. There are options in that.
Yeah.
There are ways of staging treatment. And for me, treatment coordinators are able to facilitate a lot of that work to understand what is the journey that you want to go on with this practice. And then, when we start to look at, spreading the cost options, looking at membership, the right membership for the patient, maybe even looking at, interest-free finance or different, financial options for patients, that needs to be done in a setting that is calm and quiet. Yeah. And for me, that's incredibly difficult. It's incredibly difficult to do that, without a treatment coordinator. It's not to say there aren't some amazingly talented dentists out there that are brilliant communicators, can sell snow to an Eskimo, and they don't need a TCO. But if you are a practice that has got a lot of associates in it and you want a brand experience, that really reflects what the owners want, and you want to make sure that all the numbers, the growth numbers, the diaries are planned properly, that conversion figures being looked at, follow-up work with patients is being done correctly, then the investment in a treatment coordinator is going to reward the practice without a shadow of a doubt.
So they're worth their money.
They're worth their money, 100%.
So you're team treatment coordinator for a title, but you're also team treatment coordinator for the practice.
Yeah, absolutely. And I think the other important thing to say is they do need training.
Yeah.
And I think it's a step that's sometimes missed from practices, that you do need to get training to put treatment coordination in effectively, because you can't have somebody that's become a TCO without explaining the benefits to all of the associates and the clinical team that work there and what they're going to actually do for you. Yeah, does that make sense? And I think that's a step that's missed out a lot. Associates are sometimes given something to use and they're like, well, I don't know what to do with a TCO, and then the TCO is rejected. And it's not rejected because the TCO is a problem. It's rejected because the understanding of what the TCO is going to do for you is not understood. And the other part of being a TCO is there's a real trust element, a trust between the patient and the TCO, and a trust between the clinician and the TCO. And that trust circle has got to be really supported by the ownership of the practice and all the clinicians that work in there. Otherwise, it falls flat on its face.
So it's not something you can do half-heartedly. It's just sort of think, oh, I buzz to the idea of a TCO.
No.
And then just sort of go on.
Not really. What you can do is implement the blueprint with one dentist to make sure that the rhythm of the TCO is really working for the dentist and for the TCO and for the patient, and a reception understand what their role is around treatment coordination. Once those steps have been completed and the blueprint is set in motion, then you can start to introduce it to all of the other dentists, because then they have something to watch and see and observe.
Yeah. So when Michael Bentley becomes king of the world, all practices have a TCO.
Yeah, 100%. Private practices.
Private practices, yeah, it doesn't really.
I think we need to be clear on that.
Yeah.
Yeah.
It's not an NHS thing at all, is it, really?
Well,
unless it's mixed.
Yeah, mixed practices, definitely. But I think the problem with the NHS is where does that finance come from? Do you support the role of a TCO? Would it be advantageous for NHS practice to have a TCO? Yes, it would. But it would be another layer of financial investment, wouldn't it? Yeah. Where the layer of financial investment in treatment coordination in private dentistry should be part of the fee anyway. Yeah. And the other part of it is that the treatment coordinator can spend 1 to 2 hours with every single patient. Yeah. And the financial investment in that compared to a dentist spending 2 hours, well, I'll let you do the maths.
Yeah. So really, it's a bit of a no-brainer is what you're saying. If you're a private practice, you need a TCO because it has a positive effect on the bottom line.
Yeah, absolutely. And I think I'm testament to 20 years later that when I present at really big events in the country, and then I go, how many treatment coordinators are in the room? There are a lot of hands now. They didn't used to be. No. It used to be 1 or 2. It's not anymore. So where people go, oh, treatment coordination is still in its infancy and it's, not tried and tested, that is just not true. Yeah, it's been here for well over 20 years now. And, I'm proof of that, if that makes sense, not only, in my own business, but obviously training other people to provide treatment coordination. And, you've got to realise that it's a really a key development and a key growth, for practices. So if you haven't got it, it's something to have a real look at moving forward.
Well, I'm convinced. So thanks very much for your time, Michael. I hope everybody else is convinced as well.
My pleasure.